Hello and welcome to the Antelope Valley Birth Center informational tour. And today we are going to be going through a lot of information, trying to answer almost all your questions, hopefully by the end of this presentation. Please grab a pen and a piece of paper and write down your questions as we go, but I really do hope to answer everything that you're probably wondering by the end of this presentation. So what happens here? Families are born. We provide client centered prenatal visits, natural births supported by a midwife, and water birth, postpartum visits, well person care, nursing support, community meetings, and many, many, many classes. Did you know that the Antelope Valley Birth Center is conveniently located right across the street from the hospital? Yes, we are on the corner of Avenue J and 15th West. The birth center was founded in 2015 by myself as a place where families could plan the natural birth that they've been dreaming of, a tranquil and cozy home-like setting with convenience and peace of mind of a medical center. The birth center is unaffiliated with the AV Women and Infant Pavilion at the hospital and the doctors who practice there. Though we do work closely with them to support families in the event of an emergency. So what all this means is that we are privately owned and operated. That means that I have developed my own practice protocols and have my own guidelines on how we operate in our birth center. And so you will find that some of the things that might not be afforded to you at the hospital are going to be very different. Our goal is to actually help you achieve the birth experience that you're looking for. So we walk into every situation with this in mind. Okay, we are not taking care of the masses in our birth center. We are taking care of people who have looked for us and hired us, and they are really searching for this option. So it's different than the hospital in that aspect that we are not taking care of everybody in the community. We are taking care of people who actually want to be with us, and we are privately owned, so nobody dictates how we operate. So, a little bit about me, the midwife. My name is Tisa Kareen. I have a bachelor's in business. I'm a licensed midwife. I have been a birth worker since 2005, where I was a birth doula and a childbirth educator. And then I went back to school. I used my GI Bill from the military and went back to school and became a midwife. I have been to over 350 births now, actually. This slide is a little bit outdated. And I have a very holistic mother centered practice with a strong emphasis in nutrition and autonomy. And that means that I am very big on focusing on the body and wellness during pregnancy. This is very important to me. I really feel like there's not enough emphasis on the wellness of the pregnant person during pregnancy. And really, what this boils down to is if you're not healthy during your pregnancy, the likelihood that you're going to have this beautiful birth experience, that those chances are diminished greatly. So I really love to focus on the emotional health, the physical health, and well being of the pregnant person during the pregnancy. And by default, it really creates a better experience throughout. Also, autonomy. Autonomy is super important. I personally believe that in any healthcare field that you have the right to make all the decisions for yourself. So we really, really focus in on this during midwifery care at the Antelope Valley Birth Center. I have been in the Air Force. I am a United States Air Force veteran. I was a aircraft mechanic for 12 years. I am a mom of 7 kids, believe it or not, ranging from right now, as I speak, I have a 25-year-old, a 22-year-old, 2 17-year-old girls, a 15-year-old girl, a 11-year-old boy, and a 7-year-old girl. And when I'm not working and being a mom and a wife, I am on the trails hiking for sure. I have a lifelong dream of being out on the Pacific Crest Trail. So, what does it mean to have a midwife instead of an OB/GYN? Well, midwives only take on healthy low risk clients. We are experts in normal low risk birth. We believe birth is a natural physiological process, not an illness to be cured. And what I really want to expand on here is this is that midwives came way before OBs. OBs are a new profession in the world of medicine. They are the babies here. Yes, um, they are a needed profession. They have really advanced maternal care in the United States. It is definitely imperative that we have care providers like OBs because they are surgeons and they are high risk doctors. So they really can cater to the people who need that extra level, that higher level of care. Midwives are the foundation, though. Midwives understand pregnancy, the developing baby, the changing body, the physiological changes that are going on. We have been studying and been doing this since the beginning of time as a profession. Okay. It might not have been called a job. It was more of a calling, and it still can be that today. But in today's culture, midwives seem new to most people because they have not witnessed or seen this in their communities in the past. But the reality is that midwives have been here way longer than any other profession. We really call it the first medical profession on earth. So without midwives, um, that's how babies were being born and brought into this world over, the beginning of time is that a midwife would attend and help people to have their babies. So midwives also support one-on-one collaborative care. They believe you know your body best and you are in charge of what happens to your body and your baby. They work to instill in expecting parents the confidence and decision-making skills they'll use all along their pregnancy. And I really call the pregnancy the time where we are developing our parenting skills. This is when you become an advocate for your child for the rest of their lives. We provide longer, more personal, and in depth prenatal visits and make ourselves more available to you before, during, and after your labor. So, expanding on this a little bit means that we're not just here to listen to your baby's heartbeat and send you on your way and tell you everything's fine. During a very classic traditional prenatal visit with myself, we will go through all of your physical changes that are happening during this point in your pregnancy. I'm going to see how you're doing physically and emotionally. And a lot of education happens during these visits as well. If you are struggling with a certain discomfort during your pregnancy, you're going to get a lot of information on how to help yourself get away from those discomforts because ideally there's no, you want to have a very comfortable pregnancy. And remember, as I said, that the healthier you are during your pregnancy, the better that labor and birth is going to be as well. So, my goal is to really help you have the best pregnancy you can so that way you can have the best labor and birth and postpartum period as well. Okay. We're available 24/7 as well. You come in, you are hiring a midwife, you're hiring a team, and these are the people you are going to see throughout your pregnancy and your labor and your birth and your postpartum period. There's not going to be strangers. You're not going to get who's on call. You're going to get your birth team that you have gotten to know, and we have gotten to know you. We have developed a relationship and a friendship and a trust and a bond. Midwives support you in achieving the best birth experience possible, the experience you want with your music, your blankets, supporting your choices. So I don't have an agenda. I don't have a vision for how you should birth. My goal during the pregnancy is to really get to know you on a personal level so that I can see what it is that your desires are and really kind of match that for you and do the best I can, of course, to help you achieve what it is you're looking for within realistic parameters, of course. And I have all the training and the skills to save your life and to make things um, safe in this environment and to make sure that you and your baby are safe. But ultimately, I am here to get out of your way as well. I am here to allow, and I hate using the word allow. I'm here to hold space for you to, achieve what it is that you are thinking is what you wanted. And that's what it's all about at the very end of the day. It's about helping you achieve what you desired to achieve. So, prenatal care with a midwife, what does this look like? It's personal, individualized care with a medical expert who will actually be with you at your birth, not a random stranger, right? We talked about that. You're going to be getting all your prenatal care from us, and then we are going to be there for your birth. Informed collaborative decision making every step of the way. So we don't dictate what happens to you. We have discussions. We give you resources. We inform, we educate, and we have a discussion between us, the collaboration between the family and the provider, and then we have a decision made together what's best for you, right? All regular prenatal screenings. So I think a lot of people who are very unaware of how midwifery care looks, they think, well, do I still need to see an OB? Do I still need to go outside of your facility to get everything that I need? And the truth is we are licensed by the state of California and we provide the same level of care that doctors do. Okay, so we are able to order ultrasounds. I do all the blood draws in my office, and if you need a specialist, if you need a referral outside of midwifery care, if you need a higher level of care, a consult, that will happen as well. Urgent questions answered by direct private cell to your care provider. So this is, I believe, probably something that most people value very highly. And that is because when you have an urgent question, if you are really struggling with something and you need to hear from somebody, instead of going to urgent care, instead of going to the ER, instead of going to labor and delivery, you will have access to your midwife 24/7. And so you can call and text if there's something urgent going on and be able to get a response immediately rather than having to go in and have all of that anxiety about what's going on. I don't know. And maybe you even don't even go in because you're really not okay with going into these facilities. So instead of having to worry about maybe dragging your whole family or young children into an urgent care because you're really not sure if something's wrong, you can just call up your midwife. All right, so birth at the birth center. The birth center is a cozy private birth suite with private bathroom and a separate family waiting area with its own entrance, bathroom, and kitchen. So if you have not seen our virtual tour, you need to definitely go back and see that. We have dimmable lights, a cozy rocking chair. We have everything you need to be comfortable and to customize your experience. Amazing tools for labor like the birth tub, the shower, the birth tool, peanut balls, rebozos, heating packs, cold packs, diffusers for oils, um, and just anything you could really think of. All those things that you have read about in natural birth experiences, we could pretty much provide you all of that. You have direct contact with your midwife to determine the best time to come in during labor and able to go home sooner, back to your own bed with your new baby. So the standard recovery time here at the Antelope Valley Birth Center is 4 hours after delivery. So what this looks like is that you have had your baby, you have birthed your baby, you're in recovery. We are monitoring you and your baby to make sure that you're stable, that your bleeding is normal, and that baby is nursing well. And then a couple hours after baby is born, we do a full head to toe newborn exam on baby. And then if you need suturing, we will take care of that before you leave. And then we send you off. We want you in bed recovering like you should be. You are not high risk. There's no reason for you to be in a facility being poked and prodded for the next 24 hours. Once you are home, you still have 24/7 access to the midwife. So if you get home and 3-4 hours after you get home, there is something going on that you're super concerned about, you can still call your midwife right away and get help and assistance and answer your questions. One of the midwives will come and visit you between 24 and 48 hours in your home for a home visit. You are in recovery mode. We do not want you coming back to the birth center with your brand new baby just 24 hours after you have had your delivery. So we have made a conscious decision to go out and do home visits from 24 to 48 hours. All right, safety at the birth center. The golden question, what if something goes wrong? So it is the impression with most people, they believe that having their baby outside of the hospital with a midwife kind of makes it more dangerous or more risky because they think that they don't have the safety of the equipment and the medications and the surgery unit at the hospital. The truth is that midwives attend medical school, and we are licensed by the California Medical Board. We attend tons of professional development training. And while we are the experts of normal and healthy pregnancy and birth, we also spend years training to catch any and all signs of potential problems and perform emergency care if needed. So we are very careful to make sure that we are screening our clients to make sure that you are good candidates for out of the hospital birth. The truth is that most people are not high risk, and you are not always a good candidate for a hospital birth. Okay. And midwives are trained how to use the same medications that they use for emergencies in the hospital. We carry all the same medications that the hospital does to manage bleeding and to suture you, to give you local pain relief for suturing, to do neonatal resuscitation and CPR, and to manage complications. So that's why it's super important that you attend your regular prenatal visits. This is when we are able to assess whether or not you're healthy and low risk. We work closely with the local hospital to effectively, efficiently transfer emergency cases to the experts. So my job isn't to transfer an emergency. My job is to actually deal with your situation and stabilize you. So if you are bleeding, I am going to manage your hemorrhage and stabilize you. And then I'm going to make an assessment on whether or not you need to transfer for further on care. If you need a transfusion, or if you had a great amount of blood loss that is affecting you to a point where you need to be hospitalized. Okay. And that goes for anything. We don't call 911 because somebody needs to be resuscitated. We resuscitate. And then we call a transport if you need follow-on care. Okay? The birth center has everything a hospital has to monitor and care for mom and baby. We have fetal monitors, we have IVs, we do antibiotics, and we have oxygen. We are covered for immediate care of all obstetric emergencies. So again, I'm going to fall back on my previous statement that my job is to stabilize you and actually deal with your situation in that moment, and then transport you if we need a higher level of care. Births are also supported by experienced assistants trained in the latest medical protocols and neonatal resuscitation. So our typical birth team at the birth center is 3 to 4 people. You will have 1 to 2 midwives and an assistant, sometimes 2 midwives and 2 assistants. And we are all trained and experienced in CPR and neonatal resuscitation. We all know how to appropriately use all the medications that are in the birth center, and we are skilled at recognizing and following through with emergency procedures. In the event of emergency, we stabilize mom and baby and transfer right across the street. So that's where being right across the street from the hospital has its advantages and makes a lot of people feel super secure about our location. But ultimately, this is a very small percentage of people who will need a transfer of care. But it's still there if we need it. So in the aspect of, what if something goes wrong? What about safety? I hope that I have answered your questions. We are skilled, we are equipped, and we are ready. So the more we get into this, you're probably wondering, great, how do I pay for all this and what are my options? So the Antelope Valley Birth Center is a Medi-Cal provider. We accept and we are contracted with Kern Family, LA Care, Community Family Care. So Blue Shield Promise and Health Net I'm still working on right now, and I can work with them. But the bottom line is that we are contracted Medi-Cal providers, and that no matter what plan you're in, we can help you get the care that you're looking for. We can work with most PPO insurance plans and help you get a portion of the cost covered. We are not contracted with any commercial insurance plan at this moment. We probably won't be for anytime soon. So basically, if you have a PPO insurance plan, I have a whole separate video that will discuss the prices and how it works with PPO insurance and HMO insurance, actually. So if you have High Desert Medical or Sierra Medical Group or Kaiser, then there are different rates and how that works for those medical plans as well. What are you paying for? Well, you're paying for comprehensive prenatal care with an expert in natural birth, access to a private line for midwifery support 24/7. You have a birth team who will be on call for you for the 5 weeks that you are in dates, which means from 37 to 42, we are on call for you 24/7. Your care provider takes a limited amount of clients in order to give you the best care possible, so we don't overbook ourselves. We have a maximum amount of clients that we will take in a certain time period. You're paying for the maintenance, the stocking, and the cleaning of our beautiful birth suites, and including all the medical equipment and the birth pools as well. All right, so midwifery care isn't for everyone. The birth center, a home birth, not for everybody. And I really, really want to emphasize and stress this because it sounds great to want to have a midwife, because who wouldn't want to have a care provider who listens and cares and customizes the care for you, correct? But there's a certain type of client that that this type of care is suited for. And some of these are going to make really good sense to you and some of them might not, but we're going to go over them. Your pregnancy should be normal and healthy and low risk. I will stop here and say that a lot of misunderstanding is out there about what is low risk. So I really encourage you to reach out to me and let me determine if you're low risk, because um, I find that a lot of people are given information in doctors' offices telling them that they are high risk. And the truth is you might have been high risk in your previous pregnancy. It does not necessarily make you high risk for this subsequent pregnancy. It gives us pause and it gives us a lot of time to say, yes, we need to make sure that this does not reoccur. So we're going to take extra precautions, but it does not mean that you're automatically high risk for this pregnancy. Okay. If you anticipate needing pain medication for your birth. Now, I know that it's about 50-50 when people come and they're watching this video, they're coming to me for information. Okay. If you really are afraid of pain and you are anticipating getting an epidural, then this is not a good fit for you. I do not make it my mission or my business to convince you otherwise. if you are interested in getting educated and you really want the natural birth experience and you are willing to work and do the things that are needed to have a natural birth, great. But if your intention is to just have a birth center birth and hope that pain relief is going to be something that you can magically manifest, then this isn't for you. Okay. I understand that you might be apprehensive or you might not have the confidence yet because this is still new to you. You're not sure how you're going to get through labor and birth without pain medication. But if you are willing to go through the steps of getting educated and preparing yourself, then I am more than happy to work with you. But if you are not willing to take a childbirth class and possibly hire a doula to be your support person during labor, then maybe this isn't the way that you want to go. If you don't have time or resources to make the commitment to having a natural birth, so if going to these childbirth classes, or if you're coming to prenatal visits and I'm giving you a lot of resources and you're just ignoring them, this probably isn't a good fit for you either. If you're not interested in leading the decision-making process, so if you are very used to letting everyone make decisions for you, that's just not how we operate. And I am excited if this is something that you have never been presented with before and it speaks to you. Okay? If your heart is just beating really like, I love the thought of this and it's speaking to you right now because all of a sudden you have come into this world where somebody's going to listen to you and you're going to have choices, and what you say is what we're going to do, great. But if you're looking for someone to make decisions for you around every single corner, that's not me at all. I promise you that is not how I operate. If you don't find value in this kind of support, then this definitely is not for you. I am willing to give away the house here. I devote a lot of my personal time and energy into helping you get what you need and want. So if that does not speak to you, if you do not value that, then we're probably not going to get along very well, because I do want to work with people who appreciate my time. So I do have a few requirements. And one of the requirements is that everybody has to purchase a birth kit, and you will get a link and a list of what you need to do. But outside of what insurance provides and doesn't provide is this birth kit. This birth kit has the pool liner for the water birth, and you will need to purchase that by 35 weeks, so that is delivered to you by 37. It has a lot of your postpartum supplies, a few keepsakes, and a few things for the baby. It ranges between $80 and $100. And again, we will provide you with a link and a list of that when you enter into care. We require that you show up. This means that you come to your visits. It's not my intention to have people show up for one visit, skip a couple, come for another one, and then show up to have their baby. Midwifery care is grounded in the foundation of relationship building and trust building. And we cannot do that if we are not actually seeing you show up for your prenatal care. So if you are not showing up, we have a very, very strict policy, a no-show policy. So you will want to view that and make sure that that's something that you can commit to. If it is, your intention to maybe do an intake and then maybe you're going to skip a few months because you don't find any value in prenatal care, then this definitely isn't for you. I want you to be a part of the process. Definitely do not come into the office and just roll with the punches, if that makes any sense. Show up, be a part of everything. When you are complaining or asking for help, take our help. Don't just disregard it. If Because we're here to offer you our expertise. So be a part of the process. Take care of yourself. Be willing to learn. Be willing to educate yourself. Be willing to be a part of all of it. For first-time parents or VBACs, I have a few requirements. You have to hire a professional doula, and I will provide you with a list of them that you can interview here in the Santa Clarita Valley, the Antelope Valley, and the Tehachapi area. If there is somebody that you know and trust and is not on this list, we will definitely have a discussion about that. You are required to take a childbirth class that I approve of. So not just any childbirth class. We want to make sure that it is a childbirth class that supports the natural birth process and the goals that you're trying to achieve. I will also provide you with a list of classes that I recommend. All right, so here we are. This is the end. And so to recap everything, I want to say that I hope that I answered most of your questions. You might be having more questions about the cost, and of course, that will be covered extensively in follow-up videos depending on what your insurance coverage is. But to summarize what had happened in this informational video, again, the Antelope Valley Birth Center provides birth center births for people who feel like a birth center would be better for them. Maybe a home birth isn't suited for you, but I do want to say that we absolutely provide home births for people too. And if you have questions about home birth, definitely reach out to me and ask me more questions about that. The issue with most people in this area is that home birth is not covered by insurance in any way, shape, or form. So that does end up being an additional cost to most people. So if you have questions about home birth, definitely reach out to me and I'll be happy to answer your questions. If you are at the end of this video and you're thinking, this is everything that I have been looking for, I'm on board, I want to know more, I want to know how I get started, I want you to send me an email saying that, yes, I have viewed your information video, I have seen your tour in video as well, and I am ready to get started, Tisa. So I want you to send me an email saying that you are ready to get started. Send me your name, your birth date, your due date, and let me know that you're ready to get started, and we will schedule a phone consult. This phone consultation will be a 30-minute consultation where we go through your medical history and we get you all signed up and ready to go for your physical one-on-one appointments with us. So we want you to have your best birth, and that is why we only accept the clients who are a good fit for the birth center. So I hope that all the information that we provided in the video today helps you understand what midwives or what I do here at the Antelope Valley Birth Center and what kind of care we provide. I am so happy that you sat through this today, and thank you so much. I look forward to meeting you in the future.